welcome to NED Talks. So today I'm here with Dr Michelle Barrow, who's a member of the NED editorial board and a fellow of BANT. So Michelle is the academic team director and clinical director at CNELM and has a doctorate looking at personalised nutrition practice. So is a perfect person to have on the NED platform to dig into the science. So Michelle has recently written an expert review on this paper that we're currently looking at on nutrition evidence, looking at the effect of healthy dietary patterns on male semen quality. So welcome, Michelle, and thank you for your time today.
Thank you. Thank you for inviting me.
So could we just start by looking at this paper and just giving us a high-level overview of what the authors were trying to achieve?
Yeah, absolutely. This study was trying to determine the effects of a healthy diet on semen quality, and they wanted to do that through meta-analysis. They ended up having, although looking at a lot of papers, in total only 6 cross-sectional studies with 1,244 participants met their inclusion criteria. Normally you'd see kind of clinical trials rather than cross-sectional studies in meta-analysis. So cross-sectional studies are used to determine prevalence and really don't tell you any kind of cause and effects, which like clinical trials might do. But still, it was an interesting study. And the diet approaches they looked at were the Mediterranean diet, the DASH diet, which is the dietary approach to stop hypertension, and kind of prudent, healthy diet parameters on sperm quality and motility and things like that. So basically the outcome was that dietary interventions can have a positive influence on male semen quality, but there were a number of limitations to the studies. In particular, the results showed significant higher sperm concentrations with healthier diet patterns, increase in sperm count, increase in progressive sperm motility, but there was no significant association between healthy diets and normal sperm morphology, or healthy diets and semen volume, although those were looked at.
So you mentioned limitations of the study there, Michelle. Could you just give us a bit more detail of what those were?
Yeah, absolutely. So although this study did do well in terms of how they reported it and the methodological approach they undertook, such as using PRISMA guidelines and doing quality assessment checking of each of the papers that they included, and they were also really good about reporting their limitations, such as those that I mentioned about using cross-sectional studies and the kind of numbers of studies being small, and authors not really being able to draw reliable conclusions from this study. They also kind of didn't make any comparison between specific diets, such as the DASH and Mediterranean diets. They talked a lot about food frequency questionnaires, but none of the food frequency questionnaires were comparable. Each of the studies used different types of food frequency questionnaires. And as lots of you already know, food frequency questionnaires are problematic because they rely on recall.
Fascinating. It's always nice, isn't it, when food, just simply diet, is having such an impactful, result both on an individual's health, but also the future generation as well. So yeah, really fascinating. Thank you for that. When it comes to personalised nutrition practice, then, so for people, the practitioners that are working in this area, what would be your key takeaways for healthcare practitioners?
Well, it's interesting because if you've got a male client and they have had their sperm assessed, you should be able to find out if infertility is caused by sperm motility issues or specifically sperm concentrations. So once you have the data of what is affecting the sperm quality, you can use this study to look at particular dietary interventions for each of those issues, which is nice. So they did look at particular food groups and for the diet, and which have the most kind of impact on the the sperm motility, the concentration, morphology, etc. So that's how you would apply it really in terms of personalized nutrition. Now, generally, a healthier Mediterranean diet is going to be beneficial, but for some people, this study would show that they would need either a higher fat or a higher carbohydrate diet, depending on what the particular issue was.
Fascinating. All right. So that really is taking it down to the personalized level then. So shows the benefits of testing and then actually personalizing the diet based on those test results. Fantastic. Well, thank you so much, Michelle, for your insights on this paper. You can read all about Michelle and how to connect with her on the database, just clicking on the editorial board tab here, and you can read the full expert review. Let me just scroll down to it, which is here on the database on this paper on male sperm quality. So thank you very much for listening to this NED Talk, brought to you by the Nutrition Evidence editorial team in partnership with BANT.